Okay, so my background is I'm physiotherapist and I work in Sutherland House, a natural health center with amazing team. And I'm also training clear passage, which is visceral work, and frequency specific microcurrent, which is my passion.
Yeah. So, and you've got an amazing team at Sutherland House.
Yes, we do. Amazing.
So for anyone on Eva's side who doesn't know who I am a naturopath and a functional medicine practitioner called Carolina. And I actually refer a lot of people to Eva for FSM, even though I'm trained in it, not to the level you are, obviously, Eva, but I basically met Carolyn at an event. She treated me and I was like, oh my God, this is amazing, and I had to learn. So what got you, how did you find out about frequency specific microcurrent, and what got you into it?
Sorry, I just make it a little bit louder because I can't hear you much. Okay, in my case it was a fate, I think, because my parents had a crash car accident that they almost died, and just to keep short, in basically different modalities, help them to recover and to do the rehab. And thankfully, eventually they were moved to rehab, but my mom had awful wounds that wouldn't heal, and they were thinking of amputating her leg. So I was on the mission to find something that would actually sort it. We tried every single possible thing that was available in this country and that country and my country, because they are in Poland, but unfortunately nothing was working and I was running out of time. And then my colleague who works with me had this nurse who was wound healing nurse, and she recommended Axehil, which I told you to recommend to your patient.
Yeah, I have.
They had it, they haven't released it yet, and it was all on the trial. So I signed myself that I will be doing cases. So they eventually agreed to gadget, and it was a microcurrent. So I took to Poland, I trained the physios how to use it, and within 12 days, my mom's leg healed.
So no more injuries?
To everybody. So I just started to ask if microcurrent can do that, what else can do, and I started to search the net again, and that's how I came across frequency specific microcurrent, which with no question I emailed Dr. McMacklin, but she didn't reply. She's too busy lady. So I just went
to America.
I went to Chicago, took somebody else as well, one of the team members who works with me. He's a sports specialist, a science specialist. So he went with me, we trained there, and the journey started. We came back to London and we was like, oh my God, what we can do, we can heal the whole world. So,
I know, but the thing is, not that many people have heard of it.
No, because I think there is not enough actually. We haven't been advertising at all. We haven't been promoting it. We've been so flat out with work that, you know, you have to really think how to do it and do the, but we managed to actually bring Carol to London, and she has been doing seminars now, obviously not during lockdown.
Not recently. I did my last one remotely.
So yes, so she's been already twice teaching people in London. So we have done some, but it's to promote. You can't promote if you don't have enough practitioners.
Well, how many are there globally now? 3,000? There's not a huge number of us in London, I know that, but you know,
it's not enough. I mean, there is if you really advise to patients, you really need to have enough practitioners, because we're having people coming from Birmingham, from Liverpool, from, do you know what I mean, far away, also from other countries. We have people coming from the countries.
Well, I think with your team, there's definitely you know, I would much rather, for example, send a patient who's somewhere like, for example, the United Arab Emirates. I'm going to use this as an example. I would much rather he came to London and saw you for a week than had the experience that I don't think, you know, I think that the way you practice is just much better than how other people do it, and the way your team do it is much more effective. And like, so for example, the way I practice is I do it in a session. I don't really do it as a standalone anyway, unless a patient says. And for me, I do it in a hyperbaric. So like I did with Angela this morning. And she says I had FSM this morning and loved it. But the way you do it, you run multiple machines. Your results are incredibly fast.
Yes, because once I was hooked on, I invested. I knew this is an amazing gadget. I experienced on my mother, I experienced on my daughter, I experienced on myself. I had a fibromyalgia that I cured myself with FSM. And, you know, so once you become such a believer, you just don't cut the corners. So I
Cool.
a lot of money to basically bring it, to be able to help people. Instead of having, let's say, 6 treatments, they can have 6 treatments in one.
Yeah.
And how I do, and that's why the results are amazing. I don't use on every single person.
No, I know.
6 machines, but on quite a few, I use few, because you can address, you know, body, when you have trauma, when you have injury, there is many different levels of body not functioning. So if you can address the emotions, and if you can address the trauma, and you can address the scarring and other stuff, is very different way of.
No, I remember the first time I saw you reset my immune system, and then I remember when I first came, I was not feeling good at all, and that was just the beginning of just the trajectory. And also, I have a chronic degenerative spine issue that I've had because of birth, and FSM is the only thing that's ever got me out of chronic pain.
Yes. I know, because I experienced this myself. I have that. I'm hypermobile. I had, as I told you, fibromyalgia, and that was like amazing factor for me, because that time I knew nothing can help fibromyalgia. That's it. You've got it. You have to learn how to live with it and manage it. But and I had for many years, I had no day without the pain. Being a physio, treating others, it was like, well, you know, that sometimes the physios do suffer themselves, but never mind, we get on. But actually, since the FSM, I haven't had.
Yeah, amazing. But I had another question actually that I think. So, can you just explain a little bit about like frequency treatment, and then the difference between TENS, PEMF, and the FSM machines? Because that's a question I had earlier.
Okay, so maybe I'll start with the second one. So TENS, so it is microcurrent. FSM is classified as a TENS for political reasons, but it's not TENS.
I know.
It's much gentler. It's 1,000 times gentler than TENS machine. Interferential, diadynamic. We physios, we used to use incredible amount of different currents, because each current does different things. So this is one of the currents. You can't feel it, which is nice. And we also, the way we treat patients, we put those warm towels around them, because we want to cover big areas, and those warm towels are covered with the now we use the blankets that for marathon runners. So
yeah, I know, I love that. I keep it in my car for when I come and see you.
Take with them, so it's not we don't use on anybody else, so it's your blanket, and they feel quite cozy with those warm towels. The towels do unfortunately get cooler, but under this metallic blanket, they actually stay longer, much warmer. And then we apply the current, and depends what we're treating, we put our hands where they need to be.
Yeah, and that's the great thing about how you do it, is you're a manual therapist, and your team are mostly manual therapists as well. And I think that manual work, when you're dealing with something structural, is so important.
Of course, the other so microcurrent only helps, does tremendous amount of helping. So let's take, I do issues with, let's say,
So loud here, sorry. I can't be on the other floor because it keeps tripping, so I'm here tonight.
Oh, I'm so sorry. I'm sorry.
No.
I hope it doesn't. It's too extra.
Such an additional drama I don't need today.
No, no, not at all. I'm sorry. So going back to the case that to example. So if I have, let's say, my colleagues who is trained also in clear passage, and artisans, and what the artisans are like, they do really deep bounds. They hold, let's say, intestines together. Usually they referred by clear passage of people find us now knowing that we do FSM as well.
Yeah.
So you can have adherence anywhere in the pelvis and in the abdomen, and so obviously your organs don't function proper, and you have other symptoms which you don't know. You develop SIBO if it's a small intestine, and it doesn't matter how much you put into your body to reduce that SIBO. If you have the adhesion, they will be trapped there.
Of course. The structure is so important, and if you can do all of the SIBO treatments in the world, but protocols, but nothing will help if the structural problem keeps causing it to come back.
That's right. So by applying this current and using special techniques of the clear passage that taught us, or some other myofascial releases, you can actually dissolve those bones. I'm not talking about those massive tough bones. I'm talking about spidery that glue things together. The tough bones are usually not a problem as such, as the little spidery one that actually glue things together, and they won't allow the organ to function.
Movement. So that's a great thing. Like clear passage, that's something I send a lot of my patients to you for the fertility kind of
Endometriosis as well. That's right.
Endometriosis, any sort of fertility, pelvic pain.
That's right.
So it's been amazing, great, like really getting some good results.
Yeah, it's very quick. Sometimes very, very, very quick.
Yeah, and I think that particularly at the moment, and I said this to you earlier, the whole stress of the pandemic, people not being able to have IVF if necessary at the time they were meant to, the year is ticking and people are feeling a lot of pressure. Different local areas can't keep up with the demand, and then what happens? We don't have a lot of time to help people get their kind of fertility preparation work done to kind of give them the optimal chance to have a baby, because as far as I'm concerned, like the biggest trauma I've seen kind of generally overall is always the kind of, obviously there's cancer, but like the grief of not being able to hold a pregnancy is huge, and it's like something that isn't really talked about. So I always say to people, give yourself the best possible chance, do all the testing, and then the most important thing is if you have structural issues, if there are adhesions, if there's an endometriosis person, go and see Eva. I don't care if you're on a budget, you need to see Eva.
So I work together with Judith. We usually share patients, and they all practitioners in FSM. They are advanced, fully advanced.
Your team are all really good.
They're really, really good. So when we have a patient like that, we will address the emotional. We will take we have frequencies for that. We run special programs as well, just to help them to relax, to get to the place where they can actually heal better. So also, as we do that, they don't feel the pains. If we're unblocking the fallopian tubes, they actually don't feel the pain. They quite comfortable with it. And if we ask, if the pain comes to 6 out of 10, you do need to tell us. They don't.
Amazing.
Or they could, but now with frequencies, because the body is already in different states, it's amazing that we can actually speed up the process, because obviously you don't want to cause more problem. Also,
No,
what is
but also there's also just because you need to do it quickly doesn't mean it has to be aggressive and it has to be like painful.
Absolutely. And on top of it, with frequency, we can actually stop the bleeding afterwards. Because, you know, when you work on those tissues, you can produce more trauma.
Yeah.
More trauma will produce more adhesion. So by healing, by sealing everything afterwards, you know it's safe, which is amazing for the practitioner to know.
Yeah, definitely. I think I mean, there's so much stuff that you can do that just fills me with so much more confidence about outcomes with patients. It's amazing.
Oh,
okay, I had another question about PTSD because that's something that came up. That's one of the kind of, I've been focusing a little bit on mental health last week. So PTSD is one of my favorite programs to run on myself.
yes.
That concussion and relax and balance are just nice things to do when you've had a hard day.
Absolutely.
That and the hyperbaric, amazing.
I believe you.
So like, when you run PTSD, like, do you run that just on its own or do you run that with other things? And do you find that people react afterwards? Do they release a lot of emotion afterwards? How do you manage that?
Okay, so we always ask, a lot of people do have already had a lot of therapies, other therapies, when they want to try because they feel that they almost there, but they're not.
Yeah.
And so we ask those questions before that we do the PTSD. We have questions, how they are. And then they, if they know how to process, it's quite okay to leave them by themselves. We do pop in every so often, but they are totally, you know, we have special bed for them. It's more comfortable. There is a top out, much nicer, and because it's a long program, as you know.
Yeah, it is so long.
So we make sure they hydrated, they keep on drinking water. We pop in, ask if I'm with the patient, the reception ask them as well if they need any help. If they not so sure, then I come out but usually these people know how to process if something comes up. Majority of them, they sleep peacefully and they try to read, and they doze off, try to read or whatever. We don't encourage people to watch, to be on the phones, because the fears with the frequencies. But if people are actually, they just started, and this is the first treatment they come, we stay with them, because we know of the reactions. I had lady crying throughout the whole process, so you do need to be there to hold her hands, to actually be emotionally supporting her, whoever, man or woman. So depends on the patient, depends really. You're not going to be left alone if you have no idea how to handle what can come out.
Yeah, I definitely know that, like, with some people, they can experience a little bit of an emotional kind of release in the week after. And I remember you saying to me, like, just rest as well, like you need to rest. That's another big thing is, like, with FSM, like the big thing for the treatment to work is you have to be hydrated.
Yes.
Right.
So my clinic sends everybody reminder.
Yeah, I know. I got one this morning for my Monday appointment.
Hopefully you're not going to forget.
No, I won't. But the problem is I always need to go to the toilet during the treatment because my bladder's rubbish.
That happens. But the machines have a stopper, so we can stop.
Yeah.
Patients can go, come back. It's not a problem. It happens.
I love it when I'm on a plane, which seems like a very distant memory, and I'm running like frequencies, and I'm like going to the bathroom on the plane with my little machine in my pocket, and I'm like, no, please don't go down the toilet. This is the most expensive machine I own. But yeah, like, it's great on planes if you are not a good flyer. I'm not a good flyer. I don't like being trapped in spaces, so it's good.
The only problem is sometimes you do get dehydrated anyway, so you have to drink and drink and drink.
No, I don't. I'm like, that's why I go to the toilet so much on planes. I'm literally, my husband gets so annoyed with me. He's like, stop drinking so much water. And I'm like, before you even take off, I'm like, I need to go. And they're like, you've just been. And I'm like, I need to go again. It's constant. It's bad, but that's just
hydration. we educate people how to hydrate, because people say that, you know, this is the worst thing, that you actually keep on running to the toilet, and I really fed up with that. So the ideal way is to sip little at the time for a long period of time. So that way the hydrate and the bladder is alone. It's not urging you to go. If people just drink loads and loads, obviously they will be running. So it's how you hydrate.
So, I mean, that's another, like, leads me on to my next question. What happen, like, what does a treatment look like? I think you've pretty much answered that, about how, you know, use warm towels, and, you know, people are running, like, the machines are running, but you're there, like, you're always in the room with me. And then afterwards,
I never go just like that. I'm always with them, because I am manual, so I like to feel the tissues.
Yeah.
Because I use, on top of all other pre-programmed machines, I use my manual machines, which
I know the precision. Actually,
I can feel which frequency is changing and the tissues. I like that. I like the softening. I like to communicate with the body. Also, I know how long to run those frequencies, because I will run until the changes are happening. Once the changes stop, I change the frequency. So it's a nice way of learning the body.
I know, it's amazing. I wish I had a big, I've only got a custom care in my clinic at the moment, but, you know, that's enough for what I do.
Yeah, of course, depends.
So that's amazing. So yeah, that's another thing. So obviously we're seeing people in clinic, and sometimes, you know, if someone has mold or Lyme, or Parkinson's, I remember, like, in training, it's really good for patients to then end up getting their own machine that's been programmed.
Yes.
So that they can run things on specific days at home.
Cost effective, because the treatments, you need to treat Lyme or especially mold, I think, from few months to a year. So who has this amount of money to come every week for the treatment? It's not possible for a lot of people. So we encourage people to buy their own machines. We pre-program. They have a taster though. They know how they feel. We see how the body reacts. And yesterday I had a man, not referred by you, I don't think, who I think he found me on the net, who actually has been treated by a naturopath very successfully for mold, and he thought he hasn't got it. But from my assessment, I wasn't convinced about it. So to him, I will do taster and we'll see how you feel. But you need to take those binders, which your practitioners has prescribed. And so we made a plan, and he did that. After one treatment, he had detox reaction, and he felt rotten for one day. And then since then, he also discovered that he has been eating stuff that is, well, it's maybe not moldy, but it's got some mold in it.
Yeah, I mean, like, I always send all my patients a list of, like, well, a lot of information, but there's always information on what foods contain molds, which they might not think about. Exactly. And also supplements, like a lot of it, sodium, vitamin C, ascorbate is derived from fungus. It's citrus fungus. So I don't use that a lot in my clinic. I tend to use a lot of like food source vitamin C.
Right. So he eliminated at the same time, seeing that reaction. So he realized that he has it still. And since then, he came back a week and a half after. He said, all my symptoms are gone.
Amazing.
So I said, that's not possible after one treatment. And he said, but I really feel fantastic. So can you treat something else? So I did.
No, but that's the thing. Sometimes the symptoms can, like, really clear up, and a lot of the time, you know, you have like a massive hypothalamic reaction, and it's, you know, sometimes it's not, you know, what I would aim to do in that situation is to try and mitigate that by supporting the patient with as much additional kind of binder support but not just binders, because they can sometimes cause flares. Fish oils, things like that, to make sure that the patient doesn't feel so dreadful.
But I do like working with naturopaths, and especially a good naturopath, because they know exactly how to support the body. Because the same with heavy metal. If you detoxify from heavy metal too fast, actually you're not doing good to the body.
I agree. I'm very wary of detoxing people. Like, if people say to me, I want to do a heavy metal detox, I'm going to say, well, we need to make sure that your gut's working, and that your detox pathways are working, and that we have enough binders in place.
Yes.
And this is where I see people go horribly wrong, is when they someone puts them on like a really hardcore protocol to remove metals, and then they get really, really sick. See, I've got a couple of patients who are in that situation now, and it's really interesting, because I'm like, you need to eat like this, and like, no, that goes against what the last practitioner told me. I'm like, yeah, and you're sick.
Exactly.
Maybe try something new. I think I know what I'm doing. Yeah, it can be like frustrating, because it's like, well, you're trying one thing, it's not working. And that's the main thing. I always say, look, what you're doing isn't working for you right now. We need to find another way. Just try my way.
But not everyone has such a great knowledge as you. That's why it's good to work with people who you can trust. You can communicate. You can ask. People can come with what I like. The more I know about, and same with you. The more I know about the patients, the more I can help them. So when I come from another naturopath and I ask them, please send me some results. I need to know the results of the test, not to check whether she's doing good or not.
No, of course.
Know what to apply.
No, of course, because if you can see, it's like with me, when I work with a few practitioners, and I help them with herbs for their patients. So the patient will see me for herbs, and then we'll discuss a strategy, or we'll be in the room together, and we'll kind of, and my inputs might be useful as well, in terms of like the supplements and things like that, but I don't generally do that directly with the patient. And with you've seen my plans that I give my patients, so you have, and it's all written down anyway, so you can see everything. And then being able to test, like we said, having the luxury sometimes of being able to make sure that our patients do the test that we want, particularly blood work. Like, we both use Functional DX, FDX, Jonathan's company.
Yes.
And so I was so happy to introduce you, because you're in North London, he's in North London, and it's like a match made in heaven. And the testing is incredibly comprehensive.
Yes.
And if you can, and also the other thing I really like is looking at kind of the heart rate variability, and what's going on with the heart once you've kind of been doing treatments, because I really notice, for example, my heart rate variability goes really improves after I've been doing FSM consistently. When I have like days where I don't do it, or breaks, it starts to sink again. But when I see you, it goes down then up really like dramatically. It's kind of amazing.
So we have in a clinic physiologists who actually we test a lot of patients, especially if they come with anxiety or any mental problems, and we want to balance sympathetic with parasympathetic. We do before and after, and we can see that. So that's great. Also, he very often, if I suspect that patient is dehydrated and I don't want to spend him money because I know the treatment is not going to work, I do Alex, who is the physiologist, to actually do the test, and it's very quick test, 5 minutes, and after I know. And if the patient is dehydrated, I said, no, we've got to rebook it. There's no point of me and you spending this money. So, the more tests we can do, the better, because then obviously we're saving people money as well, and disappointments.
Yeah, I think sometimes, like, there's clinical experience that will help you kind of develop the knowledge to be able to focus your treatment without wasting people's time. And I think that comes with learning, and that's why I spend so much money on my education and like continued education. But also, if you have some data, and like you can't beat blood work, really. I really think that if you have something, like, you can tell so much just from looking at even a red and white blood cell, CBC. That's all. Sometimes that's all I need to be able to see someone really needs more support. They think they're well, but I'm like, there's potential sleep apnea here, and like, an underlying virus. And then that's another thing, obviously treating the post-viral symptoms that we might be seeing a lot right now.
Yes, yes. So we actually opening the new services in our clinic, and is the physios and physiologists and naturopaths and sports medicine scientist, science master, who basically what they are going to do, they will assess. So there will be physiological assessed by physiologists and physio assessment and naturopath assessment.
Amazing.
They can actually take it in, it's kind of,
like a full 360 degree.
That's right. So there is loads they prepared. I'm highly impressed with the program. It has been the physio guidelines are basically what NHS prescribes, but they can't cope with those long COVID patients. And that's why they have been asking private sectors now to help as well. They released all those guidelines, and my colleague Anna, she actually went, she studied, she put it all together, and now they're going to start it. Yes, so
that's great. I mean, I've got to say that I've been doing a lot of work in that area, like herbally. That's basically the main thing that I do is like herbs with those patients.
Yes, it's amazing.
No, I think I love my herbal medicine. I think it's always like the missing part of anything, any patient. And now, whereas when I started, I'd be like, I'm always very mindful of people's budgets anyway, because I realize that, spending money on appointments, tests, everything, I'm sending them to you, I'm sending them to, someone else. So I'm like, okay, I used to be very much along the lines of, maybe I'll suggest a herbal prescription. But now I'm like, this is part of your treatment, like this is part of your protocol, and like it's significant. So, that is something that I really do press now, because you can get a lot done in a bottle. That's the way I see it.
Your patients are they all speak very highly about you. They already much better by
they better do.
No, but that's the truth. So they all tell me that they already much better, but you told them to come for FSM because
it's the missing link, right? Like I think, and if someone's dealing with chronic pain and they're on like 1 million medications, I'm not going to tell them to come off medication. That's not my place. A lot of my herbs that I would use for patients who are in that kind of significant pain, my herbs would interact with them, because I would have to use a lot of the Schedule 3s, even in a drop dose. So for me, it's like, well, I'm going to send them to Eva, because that's a treatment that's not going to interfere with the medications or everything else I'm doing. But yeah, that's like something that's been happening a lot recently, because that's the other thing. The NHS is so overloaded at the moment that people aren't really, they don't really have the option of waiting for a month or 2 months for their treatment or assessment. So they're having to look at what's available integratively. And I think that when you have a kind of the right combination of therapies, you can get magnificent results, like really, really quickly. And that's the thing, you've seen the patients I send you, they're so complicated.
They very, yes.
Like I don't have any easy patients. Well, I do now, the ones that are like in maintenance mode, but like mold, Lyme, everything like depression, it's never just one thing. I love my patients. I really love my patients.
Connected, unfortunately.
Of course, and as someone who has been dealing with those issues myself, it was fine for a long time, and then this year, 2020 happened. I've seen the power of how it can all come together, and it's interesting because when you look at my bloods, they're really, really good now. Like, because I was like, oh my God, I've got to get a handle on this again straight away, and it was great just seeing the change. And that's a combination of everything I was doing for myself, including the FSM. So I'm really like I love it. I'm so glad I trained in it.
So do I, and I'm glad the more practitioners we have, and the more actually naturopaths do this, they understand the way it works. So it's fantastic to communicate.
But it's like, I think that there is a differentiation between naturopaths doing FSM and manual therapists, and I don't think naturopaths should veer into territory that they are not trained in. I would never try and treat someone who needed a manual therapist, because I would not do them justice. It would just be a complete waste of their time and money. So I think that when a patient clearly needs something more, you don't. I would never. My biggest issue with my industry is people acting outside their remit, doing things they're not supposed to do, and that's a big problem. So I think there needs to just be more of an understanding about when it's appropriate to refer, and I think a lot of practitioners don't have that right now. But like in your clinic, you have everything now already. So
Yes, because once you train FSM, there is endless possibilities of treating people. So it's tempting to train, right? So we say to our practitioners, you can try on if you want to, try on your siblings, try on your family, but do not do it on patients.
No.
Not trained.
But one thing I do a lot with my friends is anti-aging protocols.
Well, that's safe.
They come in, they lie down. I give them like, a sheet mask, like an organic, lovely sheet mask, and then they'll lie down. And then if the sheet mask starts to dry out, I'll spray it with rose water, and that the electrodes are attached to the sheet mask. It's amazing. And like one time, a friend of mine came for treatment, and she couldn't drive home. She had to leave her car here overnight because she was so relaxed.
Yes. It happened to us when we had an acupuncture point. I do remember when we had the acupuncture, we used to train to do acupuncture. And the same happened. We went to the, because acupuncture works a little bit similar energies, and you deplete or increase, and we were doing very intensive training, and we had scheduled on the same day some Christmas party, and I remember we all went to that Christmas party. We all fell asleep. We couldn't keep our heads up. So yes, it can be very profound effect.
But I found it really I remember you always saying that you run concussion first to make the treatments more effective. So that does give a massive, for me, when I see patients who are in pain or they're ill, the mental aspect is such a hugely important element that you need to address. And it's amazing how you can do that with frequency-specific microcurrent, because you can actually focus on different parts of the brain.
Yes, that protocol specifically, it's basically restoring the basic function of medulla. So, and there's obviously also pituitary gland, the anterior pituitary gland involved in that. I mean, this is a master gland in our, hormonal system. So yes, it's basically enhance the concussion protocol, enhance every single treatment that we do, and combine now. I always combine together with vagus.
Yes, vagus is amazing.
And there is an infection going on. But otherwise I do, or post-virally as well, because very often if you have infection, that will be switched off, the vagus, so the whole body doesn't function proper. So I do this, and my colleagues as well. We totally non-stop using concussion with vagus, and that actually restores the health back. Because vagus will make every single organ that supplies, as we know, in our body function 100% better. So you get this straight away, which is amazing.
Yeah, and I think combined with doing other treatments at home, so for example with my patients, when I'm trying to address vagal nerve dysfunction, which is like generally activated by trauma, I'll get them to gargle until they start crying, ohms all the time, and then singing. There's loads of things you can do for your vagus tone.
we obviously, except FSM, we use other techniques as well, and how to balance the sympathetic with parasympathetic. Vagus is one of them. And so I don't know where I read, I think in the book, oh, it doesn't matter where. So it's compared that gagging reflex, when you do on the tongues with spatula and push the tongue down, it's actually like doing a sit-ups, and singing and gargling is like sprinting. So you do both cardiovascular and strength training.
Yeah. I hate the gagging thing though.
Oh, it's very good. It's very good. It's very good. It really strengthens the vagus quickly.
I know. Just don't like doing it. No, it's amazing. I love how amazing. Just simple things that you can do at home to enhance the work you're doing. It doesn't always have to be a complete chore. But my vagus is, I sing in the car. I do loads of vagal training in the car, like really loud singing in the car.
Excellent. Yes. People do in the showers.
Yeah, I don't do that because then my husband would hear me. If I'm on my own, it's fine. But yeah, like, I mean, I'm just thinking also like motility and the vagus nerve, and like just how everything can freeze up, and how effective, you know, you can be with working on the digestive secretions as well. Yeah. I think also that, you know, if you can work on dopamine, because that has a huge impact on your gut motility and like generally motility.
Absolutely. There is the frequency for dopamine. We can, especially for people who are addicted to certain things, a very, very good program. It's I mean, with those frequencies, it's endless way of doing things. It's just, as in every therapy, the most important thing is what do I treat, why do I treat. So
but also, I think that the choosing the frequency combinations is an art. Like,
yes.
You know, you can't just, you can read off a sheet and you can do the combinations, but when you have the luxury of using a manual machine, you can get the most astounding results. Yes. I love what Caroline always says, the frequencies will either work or they won't work.
Absolutely.
So you can try. Absolutely. It's not going to hurt someone.
No, they either work or they don't. But I have this tendency to blame myself if they don't work. I will dig and dig and dig. What?
Or it's just, you know, sometimes people have such a kind of deep, you know, I definitely think that the body likes to confuse. When you're working with someone who's had a lot of trauma, you know, trying to get to the bottom of what the actual problem is can take, you know, years. So I don't think you should beat yourself up if you don't, you know, if the frequencies don't quite get there in like one session, because
I know. But you know what? I always say to people that the body has incredible ability to heal. All you just do is change the environment. And sometimes the frequencies are the kickstart. Because the moment they have that hope, the moment they feel a little bit better, they actually, all those mechanisms inside the body start to slowly come up. It's just when you're in that rat place, you cannot snap out and you don't know what was the egg and what was the chicken and where are you, and you completely disconnect yourself from the body, which happens. And that's where they actually, I think, it's like with your supplements. It's sometimes it's just 1-2 that can make the body, oh, okay.
For me, like my favorite thing to use when someone's in like the state of cell danger response is Scutellaria, like bicarb skullcap. Very rarely will anyone react to that, and it's just the best herb for getting someone out of that state. So that's like my favorite herb probably in the world right now, because I have so many patients who are in this state of CDR.
Mm-hmm.
So it's nice to give them herbs that will, but that's not the only reason I use it. Just in case anyone I put it on is like thinking I basically think you're very traumatized. Not the case. It's amazing for lots of other things as well, like immune system stuff, gut, hormone detoxification, lots of things. So, but then I really think that it's again, it's all about combining the right therapies for that person. Like sometimes I'll do FSM, like when I'm dealing with something like, you know, anxiety, plus ear acupuncture, and then they'll go in the hyperback.
Okay.
So like all of them at once, or I'll give them a little essence to open up their, like open themselves up to healing, you know, a drop dose herb mix or a tea. So lots of things. And I also think FSM on a biomat is really good. I don't know if you've tried that.
No.
You should, like, if we didn't have, if we weren't in a pandemic right now, I'd say, hey, come to my office and try it. Well, actually, you could, because, you know, technically you could, but
I don't know, biomat.
Yeah, it's like a far infrared sauna mat. It's got amethyst in it, and it's really it's great for detox, but it's also, you can change the heat, and you can really like work on the emotional stuff.
Oh, so has it got its own frequencies, that mat?
I mean, it must do. I don't know. I have one over there. It's normally on my chair, but I moved it today for some reason. Because
you see, this is where we need to see whether the frequencies don't interfere with each other.
I mean, in my experience, when I've been on it with my machine, it hasn't had a negative impact. So, okay. But I mean, I will bear in mind, because I do, you know, when I dislocated my shoulder and it was just agony all the time because I kept having to carry things to my office. I was doing that a lot on the shoulder, and then you told me not to. Because the problem wasn't in my shoulder at all. It was my dura, my inflamed brain from being on Zoom all day with patients. So yeah, that's the other thing. So many people, I imagine, need that treatment, the FSM combinations, to address being on computers all day and like just eye pain and brain pain and neck pain. And
yes, so we educate people. We go through ergonomics with people, tell them to do the breaks every half an hour, go for walks as well. I know it's sometimes you just so engrossed in the wrong chair, in the wrong place, not necessarily, because at least in the office they have the obligation to do ergonomic assessment at home. No one does that for you.
That company you told me about, Posturite, they're doing visits.
I don't know if they're doing visits.
Maybe they're doing remote visits at the moment, but my standing desk is from them.
They do have educational videos, and you can basically take all the information from there and do it yourself. I know they, but I don't know if now.
I definitely would prefer someone to look at me in any situation. I'd much rather have a personalized assessment than find a video and watch it personally. That's why we do what we do, right? We're in personalized medicine, wellness. Yeah, I'm just thinking about whether we've answered all the questions I had. Manual. Oh yeah, what's different between? This is the last question that we haven't answered. I mean, my writing is so bad. I don't know if the other things are questions or me writing things. What's the difference between being treated in clinic, in your clinic, because you use lots of machines, and treating yourself at home? And why would, you know, because I think the question is like, why would you keep seeing you in clinic if you have a machine at home?
Oh,
there is a huge difference.
That's okay. So it's always best to be assessed in the clinic, first of all. So we discuss with the patients the problems and possibilities of putting programs onto the machine if they do want to purchase the machine. So that is just one small machine. They're not cheap. They're not hundreds.
No,
they're very good. So if you have only one machine, you can do one program at a time, right? So it takes you quite a long time, but it's wonderful to maintain in between the treatments when you get the boost, when you have few machines at the same time working on you, and you feel good, you're starting off, and then you're maintaining, so you're not slipping down. Although the treatments, they sustain the outcomes, if you know what I mean. So it's not like you go back unless you re-injure yourself. You should.
It happened to a friend of mine actually. She felt so good she went and did yoga after she saw you, and then she ended up stepping backwards a few.
All of those patients. I do know they feel so good. They go and clean the whole house. They do gardening. They do heavy shopping. They come back the next day. They're dead.
It's like the ones that feel really good on the herbs and they're like, they start exercising twice a day. I'm like, don't do that.
Exactly. So we do educate people. Even if you feel $100, you don't do this. You pace yourself. You really pace yourself.
Yeah.
But it's great to do the machines and treatments in between seeing practitioner. If you can.
It's also amazing if you, like, for example, the other day, I'm not swearing at the camera, by the way. I cut my finger right down to the tendon. It was awful. It didn't stop bleeding until they tourniqueted it to sew it back together in the hospital. Amazing right now, by the way, the NHS. Thank you so much for fixing me. But it literally, I ran acute tissue, soft tissue injury on it like every day, and I went in hyperbaric for like 4 days, and then I forgot this clinic. And it literally, it's completely healed. It healed really quickly within about 5-6 days. It was weird. I've never seen an injury like, now I just have little stitch marks because it was too healed when he got the stitches out, because I could only get an appointment like 10 days later. So he basically opened it up to get the stitches out, and I was like, oh my god, all that amazing work for nothing. Well, it wasn't for nothing, but that's, having a machine at home for first aid is handy too, I think.
So this is amazing, but even more so,
not as amazing as your mum, I know.
My mom's fracture. I mean, that was quite. My mom is osteoporotic. There's no almost calcium in her bones. She's very fragile, old lady, as lovely as she is. And the FSM healed days. I mean, I have documents for it. Each day document on of the pictures how she is, and on the 6th day she just went, no problem.
And then there's Terrell Owens case, where he was like an 18-month injury, and he played in the Super Bowl within 6 weeks. Yeah. I mean, that, when I heard her talk about that, and I was like googling it to check it was real, I was like, oh my god, this woman's amazing.
It is possible. I have few in the pocket situations where actually everyone was amazed. So and even going back 2 days ago, I had a lady, 74-year-old, who came looking like 94, really very Parkinsonic way of holding on to her son very, very tightly, not having any contact, eye contact, being all locked in, no communication, nothing, and she basically just lie down on the. So all the history I could take from him, she could not speak English, although he said she does speak English. So all the history I was taking through him, which is not ideal. All this happened since she had a trauma of falling. So she was very fit until then. And then 2 months she fell. And then she fell again. So the first trauma was bad enough. She started to deteriorate, but then she had another trauma of falling. And that shook her, and she was petrified of doing anything. So for the next few weeks, she was basically not doing anything, afraid that she's going to fall again. So she obviously very terribly down, and she had a gut problem as well, so I treated her gut, and I did basically the brain, the concussion and inflammation in the brain, and once I took the trauma, I did a lot of trauma in the brain. 2 hours later she got up, and she looked different. She was very talkative. She was
amazing,
all in English. And then when we walk, at first she was not sure, but because I was doing also on her, then she started to walk, and she did, I think, 10 times corridor, left and right, without me, just with the stick, correct way, straight as an arrow. And it was like her son said, "What is this?"
I know, it's crazy, isn't it? People are like, what is this voodoo?
It
And it's
can,
not voodoo, it does work.
it can,
It's frequency.
it's almost like miracle, but we know why. But to be honest with you, I was surprised myself how much change there was,
I
because
know.
her skin was bright and her eyes was bright. She had
Well, you know, if you think about how it works, you're basically, you know, increasing energy.
yeah, yeah, yeah. So,
It's
and
phenomenal.
relaxed, because she was like very. I did the Vegas as well. I did the Vegas as well, concussion
Of
and
course,
Vegas. Of course.
of course. And then that's the other thing, like it's totally safe. Like we don't treat cancer and we don't treat pregnant people, but it's totally safe for everyone other than those demographics. But we treat cancer patients, but not for cancer.
No, for
So
cancer.
if
Yeah.
they have other issues,
Yes.
we would treat those.
But saying that, I had a lump in my breast, and I did the
That was
breast
brave.
breast health for a long, long time. I mean, long time. Few
Yeah,
months.
you know, when I had a really awful pain in my right, it was the parasternal pain at the beginning of lockdown, and I was freaking out because I thought if it's come on so quickly. And then I got checked, and it was only after I had my scan that I started to do the breast health one. Pain went next day. I was like, oh, it wasn't even my boob though, it was my shoulder. But
Oh,
I think it was causing some tissue inflammation. But it was quite amazing how quickly the pain went. And I was like, but the thing is, I was not prepared to do that without making sure that there wasn't anything going on there. Because I know that the studies support, but there's not enough studies. So, you know, we like to be safe.
of course, but I was just before going for biopsy, and I thought I really don't fancy that biopsy. I'm gonna do the FSM, and God help me, I'm sure I will be better. And I was, because when I went to the consultant and they put me on the ultrasound, he said, "Where is the lump?"
That's what the doctor said to me once when they looked at my gut. I was
Enough,
like,
but another MRI. They compared the pictures and they said, "Well, it looks like you haven't got it anymore."
looks like we made a mistake. And then that's always what they say. Maybe we got it right, but no, it's amazing when you can get results like that. It's absolutely incredible. So
Well, every single time, but it happens.
no,
You all
and also sometimes, you know, obviously most of the time you need more than one treatment. It's not miracles. You know, you can really see a significant improvement, but it's not like a magic wand. Kind of a little bit sometimes, but it's better to manage expectations properly, right?
absolutely, absolutely.
So yeah, I think like we should probably sign off now because we've been yabbering for an hour. Although it's been absolutely amazing because I love talking to you, and I never sleep during my treatments with you because I just love talking to you and catching up and talking about our patients that we work on together and like collaborate on. And it's all about collaboration and working with people that are aligned with what you do. You know, you have a shared aim and you know, whose values align with your own. I think that's the most important thing.